What if healing from trauma didn't require retelling every painful detail over and over again? What if your brain already knows how to heal and therapy just helps it finish the job? Today, we're talking about eye movement desensitization and reprocessing, or EMDR therapy. What it is, how it works, why it's one of the most researched trauma treatments we have. If you've heard of EMDR, you might picture someone waving fingers back and forth in front of a client's face and wonder, how could that possibly help trauma? And that's a fair question. Let's break it down in a way that actually makes sense. What is EMDR? EMDR stands for Eye Movement Desensitization and Reprocessing. It was developed in the late 1980s by psychologist Francine Shapiro, who noticed something surprising. When people recalled disturbing memories while their attention moved back and forth, like during eye movements, the emotional intensity of those memories often decreased. This observation eventually led to a structured therapy model that is grounded in neuroscience and memory research. At its core, EMDR helps the brain reprocess traumatic memories that are stuck. Shapiro proposed something called the Adaptive Information Processing Model, or AIP. The simple version of that is your brain is designed to process experiences and store them in a helpful way, kind of like filing information into the right folder. But trauma interrupts that process. Instead of being stored as a normal past memory, the experience gets locked in with intense emotions, body sensations, negative beliefs like I'm not safe or it was all my fault. And that is why trauma doesn't feel like something that happened in the past. It feels like something that is still happening to you. EMDR helps restart the brain's natural processing system so that your memory can be stored correctly in the past where it belongs. EMDR therapy follows 8 structured phases, including history taking, preparation, identifying target memories, the bilateral stimulation like eye movements, or sometimes we do taps or different tones in the ears, and integrating new insights. During the processing phase, the client briefly brings up aspects of a traumatic memory while engaging in that bilateral stimulation, meaning stimulation that alternates left and right. The therapist is not interpreting, analyzing, or directing the content. Instead, the client's brain leads the entire process. This is important because EMDR is not about erasing memories. It's about changing how they're stored and how they affect you now in the present. Research shows EMDR can reduce intrusive memories, emotional reactivity, trauma-related beliefs, and physiological stress responses. Many people report that memories feel more distant, less emotionally charged, and no longer define who they are. Shapiro emphasized that healing happens without requiring detailed verbal recounting, which can be especially helpful for survivors who feel overwhelmed by traditional talk therapy. Let's clear up a few misconceptions. EMDR is not hypnosis or mind control. It's not exposure therapy alone or a quick fix that skips safety and preparation. Effective EMDR requires a trained clinician, strong therapeutic relationship, and careful pacing. Stability and consent always come first, and your EMDR therapist will always help you come up with a stop signal, which you're in control of at all times. Who can EMDR help? EMDR is best known for treating PTSD, but research has also supported its use with childhood trauma, sexual assault, domestic violence, medical trauma, and many other adverse life experiences. It's now recommended by organizations like the World Health Organization and the American Psychological Association for trauma treatment. If you're considering EMDR, here are 3 grounded steps you can take. One, make sure that you're working with a trained EMDR therapist. It requires specialized training, and that matters for its effectiveness and also your safety. Two, ask about preparation and pacing. A good EMDR therapist will not rush you into the trauma processing or require you to share every detail. Know that healing doesn't have to mean reliving everything. EMDR respects the nervous system and the brain's capacity to heal at its own pace. Trauma isn't a personal failure. It's a nervous system injury, and EMDR offers a way to work with the brain rather than against it. If this video was helpful, you can like, subscribe, or share it with someone who's curious about trauma healing. And if you want more videos breaking down therapy approaches in plain language, I'll see you in the next one.